Now, heart attacks cost the Australian health system millions of dollars each year, but new research out today has found worrying gaps in the steps taken to stop further attacks.
To tell us more and to get the response, we're joined by Robert Grenfell, National Director of Cardiovascular Health at the Australian Heart Foundation. Robert, good morning.
Good morning. Good morning.
This research, according to Associate Professor Julie Redfern with the George Institute for Global Health in Sydney, says that according to what they looked at, 3 out of 4 post-heart attack patients were not properly dealt with in at least one of 3 areas, and that's appropriate medication, a referral for rehabilitation, or advice to live a healthier lifestyle. The suggestion is they had their heart attack, they're taken care of, and they're just pushed out the door. Is that your understanding of what's going on?
Yeah, this is certainly a landmark study that they've released today. And yes, we've known for a while that the system, after you've had your heart attack, is not actually serving patients as best as it could. And again, the findings of only 1/4 of people after a heart attack actually getting the right toolkit to prevent that next heart attack is alarming. The system itself is not working and we need improvement, so we need to focus on making sure the right medications are getting to people for sustained time.
How are those potentially life-threatening gaps, as you say, in the health system emerging?
They're emerging in repeat events, repeat heart attacks, and if you have another heart attack you are certainly likely, if you survive that, to end up with heart failure, which leads to lifelong disability, and that of course means that you can't work anymore, can't participate if you can't play with your grandchildren. So these are in fact actually serious conditions and it's preventable. That's the alarming part about this.
Do you agree with what the findings seem to suggest, that the fault lies with the medical fraternity rather than with patients themselves? Is this a case of doctors not following up and not putting in place a network, if you like, to take care of those people? Or is it patients who are not taking care of their own health?
Look, this is, like most health problems, complex, and unfortunately the system is the problem. Now the system consists of the doctors, the nurses, the hospitals and the patients themselves. So many patients leave hospital not understanding what actually happened to them and not understanding the importance of making those lifestyle changes and taking the pills. On the other side, many hospitals are focused on saving their life, making sure they get the right emergency treatment, but neglecting in the sense of the treatment that they should be getting afterwards and connecting to what happens with the community care.
Doesn't this get back to then the relationship that we should have with GPs?
Yeah, definitely. I mean, the improvement that needs to occur here is a focus from a hospital perspective on making sure everyone who leaves hospital has a right plan for preventive care and medication that's connected.
And that plan then has to be enacted in consultation with your GP?
Absolutely. You need to be seeing your GP. And someone after having a heart attack needs to see their GP within a few weeks, and they need to see their GP on a regular basis to make sure that their blood levels for cholesterol and blood pressure are at the right level, that they actually have stopped smoking, those types of things.
Now, Brian Aller, the new president of the Australian Medical Association, has not surprisingly hit back at this study. He doubts the findings and he makes the point that often GPs don't always record referrals and advice and therefore they won't appear in studies when surveys are being undertaken. Is that a fair point?
Look, with a study like this is called the snapshot study. It's the first of its kind in Australia, and it was actually a snapshot of 4,000 heart attack sufferers in Australia and New Zealand over that period of time. And what Julie's done is in fact follow those for 18 months into the community and has done a meticulous effort of in fact actually finding out what happened to those patients. Now, we do know that GPs can only achieve around about 70% of the required medications, and those are quality focused general practices. So there's a lot of work that needs to happen in that area. But if someone's leaving hospital and only 1/4 of those are actually getting the right treatments and advice, there's a problem there as well.
Just following up on the questions about the GPs and the importance of that relationship, we know of course one of the hot political topics at the moment is a potential co-payment to go and see your GP and what might result the decline in visits to GPs. In the context of this study and following up on heart health, how do you see that policy shift? Is it a useful one or not?
As with any chronic disease, the institution of a pay disincentive, as has been touted, would of course be alarming with the sense of whether or not people would actually see their doctor for this advice. And that if this does come through, the Heart Foundation would certainly be very keen for monitoring of this, and if any deleterious effects were occurring because of co-payment, we'd be pushing for those to be rectified.
Well, it sounds like an organisation like yours and the AMA actually need to get into the same place on this, because you're not. I mean, as Michael mentioned, the AMA has rejected this, saying the doctors doctors are doing the best they possibly can, and you've got a different point of view. How do you reconcile this?
Oh, look, no. I think doctors are doing the best they can. I think that the system they work in is not allowing them to do that part. That, all healthcare workers go to work trying to help people, and it's the things around them that actually stop them from doing that. So there are the patient factors, there are the issues of referral, there's the cost disincentives, there's the absence of lifestyle prevention programs and things like this, and also the linkage. Those are the problems that actually are occurring in our system.
All right, well, look, good to talk to you this morning, Robert. Thank you very much.
Thank you so much for your time.
Thanks, Rob.
Thank you.
Thank you.